Good afternoon. This is Andy Reese with Department on Disability Services. As always, I will start by sharing our data. We have had, unfortunately, one additional person test positive in the last week. This was an unvaccinated person in a natural home, bringing our total up to 450, which is, if you add up all of the months there, you'll get to 452, but that is because we had 2 people who have been reported as positive twice. By placement type, we have had 9 people in host homes, 114 in intermediate care facilities, 1 in a mental health facility, 64 in natural homes, 2 in a nursing home, 4 in out-of-state placements, 42 in residential habilitation, and 214 in supported living placements. So the people in ICFs, the 114 who have tested positive for COVID, represent about 38% of people in intermediate care facilities. Of those 114 people, we have had 28 deaths. However, only 13 of those are confirmed COVID deaths, representing about 11.4% of the people who in ICFs contracted COVID and had a confirmed COVID death. In natural homes, the 64 people represent just about 7% of people in natural homes. Of those, we have had 6 deaths, but only 5 are confirmed as COVID deaths, representing just under 8% of people in natural homes who've contracted COVID and have had a confirmed COVID death. In residential habilitation, the 42 people who've contracted COVID represent almost 39% of people in residential habilitation. There have been 3 deaths, but only 2 of those are confirmed COVID deaths, representing just under 5% of people in residential habilitation who have contracted COVID and have a confirmed COVID death. In supported living, we've had 214 people that represent about 22% of people in supported living. Of those, 26 have died. However, only 15 of those are confirmed COVID deaths, representing about 7% of people who contracted COVID and had a COVID confirmed death in supported living. So overall, the 450 people supported by DDA represent about 18% of people supported by DDA who have contracted COVID. And of those, the 37 confirmed deaths represent about 8% of people who are supported by DDA who contracted COVID and have had a confirmed COVID death. So this month, as I said, the 1 person who contracted COVID was in a natural home. And to date, still, we have not had anyone who has required inpatient care for COVID since April of 2021. 66 people who have had COVID have died. However, of those, 16 have been confirmed as not COVID related. And for 12, we are still awaiting confirmation from OCME regarding the cause of death, so that the total number of people who have confirmed COVID deaths is 37, and the last death that we have that was confirmed as COVID related was in March of 2021. Among our provider staff, 746 staff have tested positive for COVID. 55 of these staff have been reported by more than 1 provider, and 10 staff have died from COVID. Vaccination rates for people supported by DDA, it's overall 82%. In host homes, it's at 89%. Intermediate care facilities, 99%. Natural homes, 65%. Residential habilitation, 97%, and supported living is at 91%. Among our provider staff, it is at 94%, and it is also at 94% for DDS staff. There's a question here, and I don't know if this is something DC Health can answer, if there is a particular standard. Uh, is there a What is the temperature threshold for not being permitted to enter a day program? We are still using 99.4, which was previously recommended due to healthcare facility definition, but I wonder if we could increase that to 100.4. And I will direct people, I think that there was guidance on day programs that was put together that can be found on our website. Which has links to all of the health information. It links you to coronavirus.dc.gov as well as the CDC guidance. But if DC Health can comment on this.
Good afternoon, Director Reese. Generally, our guidance has said 100.4 for some time. So I'm not quite sure where the 99.4 came from, if that was a margin of error or just something more conservative that was implemented early in the pandemic. I'm uncertain, but 100.4 would be consistent with other guidances that DC Health has.
Thank you. So last week we had a question about whether we could report on testing policies from our providers. And so when we collect the data regarding vaccination rates, we are going to start asking questions about the providers' testing policies. And it won't just be do you or don't you. There'll be a couple of questions because, what you want to get at is who are you testing? Are you testing both vaccinated and unvaccinated? Because people may be aware for long-term care facilities, nursing homes, hospitals, there is still testing of vaccinated staff. And, and for example, with the district government, we have folks who are required to test because they've not been vaccinated. The regulations that have been implemented that require vaccines for staff but allow for exemptions allow the provider to require testing but don't include the requirement. And so making sure that we can provide good information about what individual agencies reporting testing policies are will be helpful. And we will make sure that we have some questions added so that you can easily check off yes or no to the questions, and that we'll be able to have the information that people are interested in. Just keeping in mind, today is December 10th. We will have a forum next week, but then the following 2 weeks are both holidays. And so this might not be information that we will be sharing. It's surprising to be saying this until the beginning of next year. So in 2022, we should be sharing that information with people. Hard to believe that we are almost there. I also just wanted to give people an update regarding electronic visit verification. DHCF has officially started denying claims for non-compliant providers regarding the electronic visit verification. If providers have questions about electronic visit verification, you can contact DHCF at evvinfo at dc.gov. They can also be reached by phone at 202-905-4388. And for technical assistance with EVV, you can contact WDC Customer Care at SANDATA, that's SANDATA.com. And you can also reach them by phone at 855-962-1322. I will type all of that information into the chat. There's a question just to clarify. Unvaccinated staff who have submitted exemptions are to test weekly, correct? And actually, the regulation does not say that, but what the regulation says is that an individual agency can impose these requirements. It does not require it doesn't require you to do the testing, but an individual agency can determine that they choose to. I'll take advantage while I don't see questions to type the EVV information into the chat. This says Dr. Reese. There's for all the time I spent in school, there is no doctor. Although Juris Doctor, but we don't count that. But at any rate, Andy works just as well. So I understand that the coalition made the decision not to include DSPs in host homes and SL settings in the bonuses. Is there anything that can be done about this? All DSPs work hard and deserve the bonus. Unfortunately, we didn't invite someone from DHCF who could explain how the determinations were made regarding the bonuses that were paid. As I said, I know that they worked closely with the provider coalition, and perhaps they could provide information about that. I don't know how those decisions were made. Those were paid by DHCF very recently. Unfortunately, I don't have as much information as I'd like about that to respond to that, and I will try and make sure that by next week I can at least provide answers about how those decisions were made.
Director Reese, this is Nelson. I just wanted to provide a clarification because I misspoke earlier. Generally speaking, for healthcare facilities and high-risk populations, we use a temperature of just 100 even, greater than 100. When screening, instead of 100.4, for some reason, the CDC made that distinction that 100.4 is, more for the public, and a more conservative temperature of greater than 100 is appropriate for those high risk settings. So of course, 99.4 is less than that, so you could certainly increase to 100. I'm comfortable saying that at this time. But I'll also bring back to leadership to revisit and see if we can get that to be the same across the board, and see if there's an appropriate recommendation across the board. But for now, I'm comfortable saying 100 is appropriate.
Thank you.
I can say, just looking real quick at the supported living and CRF settings, it is in that guidance. So it's probably in your guidance specific for your setting. Of course, we don't have day program guidance anymore, but I can direct you to the link to coronavirus.dc.gov/healthcare for your setting specific guidance. And it's likely that it's there. And if it's not, you can reach out to me and I'll try to find you something.
Can someone share information on how we can connect with other providers? I mean, my recommendation would be, and I don't think this is any kind of inappropriate endorsement. For one, there is the DC Provider Coalition is one way to connect with other providers. We also do have an upcoming provider leadership meeting. And, the challenge with things being remote, the benefit of coming to meetings is the after meeting, because that's the opportunity to then really meet people and speak with them. So we are still, for many of these things, in a remote status, even though we are all here at work. And so, so I would just recommend, participating in the provider leadership meeting and then asking the question there about other opportunities. I will also say, unlike the unlike the requirements that Nelson just mentioned for long-term care facilities, the guidance that was approved by DC Health, issued by DDS, and has not been updated for day programs does say 99.4. So I do think it would be helpful for us to have one consistent standard, but I do know that the guidance that is published on our website, the day services best practice guidance, which was developed quite some time ago, actually. But as I've said before, all of the links remain live so that as things are updated, you get updated to the more current guidance from CDC or DC Health. But the specific guidance in that is that it's 99. The screening says no greater than 99.4.
So then in that case, directories, that would be something that would have to be changed then for them to alter their threshold. Because it would defer to DDS since we don't have something specific for day programs.
And to the extent a program has a higher standard, you could have a higher standard. I don't see, there we go. The next provider leadership meeting will be held on December 16th from 10 to 12. If you have questions about that, please contact Shasta Brown at shasta.brown@dc.gov. Just as a reminder, if people have questions, you can make sure that you type them to everyone so that we are able to see the question. If people don't have questions, we could also end early. As a reminder, next Friday will be our last meeting in the year, and then we'll come together again at the beginning of 2022. Someone had asked for the Provider Coalition website information. It is dc-coalition.org. So if we don't get questions in the next couple minutes, we can end at 12:35. If that's the case, have a good weekend. Just as a reminder for people, tomorrow is the project action meeting. You can participate remotely. It's still not an in-person meeting, and that is at 10 a.m. tomorrow. And that is a Zoom meeting. And there's the link for the project action Zoom meeting. And that's tomorrow morning from 10 a.m. to 11 a.m. Oh, because after saying put it in everyone, I just posted the link in panelists. So here's the link. So one thing I will just say, our guidance is a recommendation. So there's a question here. Person is saying, I appreciate the weekly opportunity to connect and to connect with DC Health. I look forward to an update on streamlining the guidance documents regarding health screens at day programs. For now, we will stick with 99.4. We would like to match the 100.4 that we use for the special education school. Our guidance is a floor. And so anyone that would like to, if a provider has a higher standard, then then that is fine. The EVV contact information is also now in there so that everyone can see it. Oh, and I'm talking backwards here. 99.4 is a higher standard than 100.4. So anything higher than 99.4 is pretty strict. And so if that strict standard is there, that is the minimum. Sorry about that. Sorry to be confused thinking higher is better. Sometimes higher is worse, as we all know. And I'm not, yeah. So we will talk with DC Health about this and see if it needs to be updated to make sure, as Nelson said, that we have a consistent standard across the board. Sorry for any confusion there. Um, at the same time, making sure people are absolutely healthy when they come into your day program is an important thing. Now, I don't know about you, but I don't feel well when I have a temperature that's at 99.4 even though a fever isn't until you get to 100.4. So, we want to continue to take every measure possible to keep us all healthy. Including face covering, getting your boosters, um, because those are now recommended for everyone over the age of 18. And also making sure that if we are not feeling well, that um, that we stay home and protect ourselves and others, not only from COVID, but from the flu. The passcode for the project action meeting is posted. It's 202200. Okay, well, have a great weekend, everyone, and we will talk again next Friday.